Thank you, Mr. Speaker. Now I don't know if I can talk. To the bill.
To the bill.
Let me be clear, perfectly clear. House Bill 2002 is personally and emotionally egregious to me. It goes against absolutely everything in my core being of what and who I am that makes me the person I am today. For me, House Bill 2002 is morally and ethically wrong. I've had many sleepless nights over this bill. I wake up in the middle of the night, just about every single night lately, worrying about what's going to become of the world that my grandchildren are growing up in. How do I protect them and keep them safe when the state that they live in doesn't care about the things that they have been raised and are being raised to believe in? Both of my grandfathers were preachers. My parents were married over 50 years. My dad was the head of our household. Even after he passed away, we would always talk about what would Dad do in this situation? What would he think? What would he want us to do? And I was an adult when he passed away. He was a lifelong Democrat. He would be very upset about this bill. It goes against absolutely everything he taught me. Life is precious, and our children are precious. I have raised my children to be respectful of others' opinions, to talk about things that bother them and that they do not agree with, and not use anger as a tool to get their message across. But today, I am angry. I am heartbroken for the children and their parents. Not one person who helped craft this bill asked me how I feel about the contents of this bill. Not one person called any of my constituents and asked them how they would feel about the contents of this bill. And when my constituents and others testified against this bill, were they listened to? The answer to that question is no. When my colleagues raised questions about House Bill 2002 and the ethical and moral problems with this bill, were they listened to? The answer to that question is no. House Bill 2002 divides families. House Bill 2002 separates children from their parents and their grandparents. It takes away parents' rights. House Bill 2002 deludes our children into thinking they are the ones in charge of their lives and health care before they are mentally capable of making life-altering decisions that will affect them the remaining days of their lives. I was the primary nominee in my district by both Republicans and Democrats. I have had just as many Democrats as Republicans call and email me telling me to vote no and to kill this bill, and the list of objections are numerous, to say the least. We are debating the merits of policies that bitterly divide Americans, necessitating true cooperation between all members of this body. Yet the bill is predicated on using government funds for projects that many Oregonians consider morally wrong. Revenues to support the implementation of House Bill 2002 come primarily from the general fund, while Oregon has for many years allowed taxpayers to make additional contributions to certain programs which could have been added to this bill with ease. The Behavioral Health and Healthcare Committee chose to mandate that many Oregonians be forced to pay for policies that they consider morally and ethically wrong. If there was a goal to normalize abortion and convince more Oregonians to support it, this bill achieves the exact opposite of that. House Bill 2002 establishes a student health care reproductive health grant to administer the bill and make grants to student health care centers for over $1.6 million and to be deposited from the general fund into the grant fund. providing grants for student health care centers as institutions of higher education. Despite Oregon's low education attainment, this bill seeks to prioritize funding for the unrelated matters of abortion and gender-affirming care. Oregon students are not going to be prepared to participate in the workforce tomorrow if they have access to on-demand abortion facilities on campus. Federal funds for the bill come from administrative Medicare matching funds. This continues to an unfortunate trend of promoting policies over policy. Medicaid is supposed to be a stopgap for families in need of medical help when they cannot afford private insurance. Oregon's delirious rate of poverty is not so dizzying that the needs of the poorest Oregonians are being met with Medicaid. Rather than improving existing Medicaid services, this bill seeks to throw money at a problem that very few Oregonians are experiencing, but you can darn well bet the out-of-state people will be coming to our state in droves. This bill is doing nothing to address the causes of poverty in Oregon, mainly an unfriendly business climate and the death of timber, thus defeating the bill's own purpose of providing abortion and gender-affirming care to impoverished Oregonians. House Bill 2002 updates Oregon's law to expand access to reproductive health care, but I couldn't find that reproductive rights for what we want only covers the right to terminate pregnancy. Where's the right to bring a child to term? The right to an economic situation that allows individuals to afford pregnancy care? The right to access pregnancy resources? None of that is in this bill because this is about politics, not about health care. The bill purports to establish an individual right to make decisions about reproductive health, limit governmental bodies that interfere with decisions about reproductive health, and require student health centers to provide access to emergency contraception and medication abortion. The central concept of municipal charter reform in Oregon's Constitution is to grant legislative powers to cities. Every session, cities bring a list of concerns, protections, and funding requests that are summarily ignored. Instead of focusing on their concerns this session, we chose to make them targets for additional litigation. Universities and community colleges are routinely underfunded, but this bill seeks to foist additional health services upon them. We could at least allow on-campus crisis pregnancy centers instead of forcing abortion facilitation, but that was not considered during the drafting of this legislation. The bill requires the Office of Rural Health within the OHSU to administer a program to provide grants to 2 federally qualified health centers in rural and medically underserved areas of the state. The grants will facilitate the operation of a pilot project providing expanded reproductive health services to individuals living in areas of the state with limited access to reproductive health care. Rural Oregon is in a tremendous amount of trouble, faced with deteriorating economy following the intentional death of the timber industry and the regular passage of laws that make doing business outside of the Willamette Valley extremely difficult. If invited to participate in the process of drafting this bill, rural Oregon leaders could name an endless list of priorities of far greater importance than reproductive health centers. We should listen to rural Oregonians' leaders before deciding the priorities that their communities need. The bill also prohibits health insurers, including the Oregon Health Plan, the Public Employees Benefit Board, and the Oregon Educators Benefits Board, from excluding medically necessary gender-affirming treatments from their plans. It requires insurers to make sure there are enough providers in their networks to ensure patients access to gender-affirming treatment and services, among numerous other provisions intended to maintain or improve access to reproductive health and gender-affirming care. This is an undue burden on insurance companies as we seek to deal with the growing labor shortage, with many diseases and medical conditions far more common than gender-affirming care. We could be looking at a system of rationing care in the future, and politics should not determine what is prioritized. I do not agree with this bill, and I don't want my name on it as passing it. And I vote no on House Bill 2002, and I urge everybody else in this chamber to do the same. Thank you.
Thank you, Representative, for the discussion. Representative Stout.
Thank you, Mr. Speaker.